Hello, I'm Dr. Al-Rubayee, a general practitioner dentist located in Thornhill, Ontario. Today, I want to talk about a hot topic in implant dentistry, which is screw versus cement retained implant restorations. Which one is better? The reality is, one isn't better than the other. It should be a case-by-case basis to be evaluated for what's right for you. Screw retained, from the name, the crown is attached to the implant with a screw without using any cement. So one of the biggest advantages here is retrievability. So if you want to take out your crown, you can by just unscrewing the screw. Most of the time, we don't have to remove our crown. But this feature becomes really handy when you're doing a full arch restorations like all-on-4, all-on-5 or 6, when you have to deal with an implant that's having a bone loss or any inflammation, peri-implantitis. It's just easy to just open, deal with that implant, and then you can close back with just tightening the screw. The other type is cement retained. But why cement gets a bad rap? It's just because if you're putting too much cement, that excess cement can go under the gum in this sulcus close to the implant, which can cause tissue inflammation or a tissue reaction, peri-implantitis, or bone loss, and it could cause a failure of an implant. So this is the main disadvantage of having a cement retained restorations. So when we have to make sure when we are cementing a crown, we use the right type and the tiniest amount of cement to keep that crown in place. On the other hand, the screw retained restorations have a screw hole access where we have to fill it with a composite resin material, which is not very aesthetic. So if we're doing a front and anterior implant and the implant is angulated to the buccal, and we have to do screw retained restorations, then the access hole is going to be showing from the front on the labial surface. So in this situation, I might go for cement retained. There are other solutions like using angled screw channels where you can bend the screw and you can access the crown from the lingual size to overcome an angulated implant. There are some cases where the implant's crown are too long and you try to do screw retained restorations. This could cause a lot of pressure and stress on the screw, which will increase the chances of a screw breakage. In other situations, your crown is too short, especially on the posterior area. When you try to cement retain this crown, it's not going to hold. So in this situation, I might go for screw retain. So bottom line, screw retain or cement retained. Which one is better? As I mentioned, it should be a case-by-case basis to be evaluated for what's right for you. I hope that short video helps you to decide what's better for you. Thank you for watching.